We only get one set of eyes, yet many of us take our vision for granted. There are many diseases and conditions that can affect our vision, such as diabetes. What many don't know is that it is the leading cause of blindness for people under 65 in America. For people over 65, the leading cause is age-related macular degeneration. In recent years, we've heard about repetitive injections directly into the eyes and laser treatments that potentially burn. We recently spoke with Dr. Leonard Ginsberg, chairman of the More Eye Institute. He was the first to introduce in Pennsylvania the OCT, the most important diagnostic test for the two leading causes of blindness in America, diabetic eye disease and age-related macular degeneration. Dr. Leonard Ginsberg tells us about diabetic macular edema, the most common cause of vision loss in diabetic patients, and explains how this condition is diagnosed and treated.
Diabetic macular edema is a condition where the retina, the film of the eye, suddenly becomes thickened. The blood vessels of the eye, pipes, suddenly start to leak. This leakage can cause what needs to be dry tissue suddenly for you to have trouble with blurred vision. So here we see in this illustration a normal retina, but it starts to leak, and you see the retina suddenly becoming 4 times the size. Here is a case of an OCT where a patient has a portion of her retina that's very normal, but if you rotate it down, you can see suddenly cysts, fluid pockets that are filling the retina, the film of the eye. So what do you do? Once we've diagnosed it, how do we make this sponge dry? You've got 3 alternatives. 1, intravitreal injections. What they do is counteract a negative product that the retina, when it's sick, starts to produce. Only lasts for 30 days, so therefore you have to do the injection every month. The other is the traditional hot laser, which is a continuous beam of hot light. It's like taking a flame, and you put your hand over the flame, and you burn your hand. Now, what if we could move the hand really quickly? Then you don't leave any permanent spot. That's the micropulse. It's at 1,000 times faster than a traditional laser, so there's no burn. So for the first time, we can treat the actual center of the vision, the most important part to treat, to make these cystic fluid pockets go away and to watch the retina in 2 months flatten out. It was really one of the most exciting moments of my career.
Well, I just had the laser work done, and it was easier than an injection. I mean, who wants to get a needle in the eye? So I'm quite sure that this will work out just fine. And I'm glad that I did get this done.
Uveitis is a group of disorders that reveals a lot about systemic disease, which is very similar to diabetic eye disease. Diabetic patients tend to have various other medical problems, including collagen vascular diseases that can also affect the eye. I wanted to join a place that values the multidisciplinary approach to eye disease, which is why I joined the More Eye Institute.
Dr. Ravi Patel of the More Eye Institute explains other effects of diabetes on the eye and their surgical care.
Patients who have diabetic eye disease have a 4 times greater incidence of developing cataracts. Along with cataracts, patients are prone to developing bleeding in their eye or scar tissue in their eye, requiring vitrectomy surgery to remove the blood and scar tissue.
No one wants injections, lasers, or surgeries. We asked Dr. Ginsberg about preventative measures that can be taken to reduce the risk of vision loss and his pioneering multi-specialty approach as the only certified diabetes educator in America who is also a retina surgeon.
There's no condition in all of medicine where it's more critical that the patient be a partner with the entire healthcare team. Diabetes affects every part of the body. We know that if blood sugar is tightly controlled, 73% of all complications can be eliminated. Forget the laser, forget the injections. Just by tightly controlling your blood sugar, going to that exercise physiologist, going to the dietitian, going to your family physician, endocrinologist. Frankly, vision loss is one of the most scary things anyone can have. And I think that medicine is becoming too specialized. Every single doctor is their specialty that they just do, and they don't think about the whole person. And in diabetes, you have to think about it. And that's why working with the endocrinologists, the family physicians, the entire team, but most importantly, the patient himself or herself and their family can make all the difference in the case of diabetes.
Unfortunately, despite the best care, there is no guarantee against vision loss. What happens when injections and surgical options are exhausted? Dr. Ginsberg shares how his grandparents' failing eyesight and his subsequent training at Harvard University's Joslin Diabetes Center can inspire people to not give up hope.
At the age of 16, I watched my grandmother, Belle Moore, lose her central vision from macular degeneration. And the retina doctor said nothing can be done. She can walk around, she's okay. But my grandmother could not see my face. That was not the right answer. I took her up to Boston where they maximized her vision, and suddenly she could see my face, and it was the happiest moment of her and my life Don't ever let any doctor not answer your questions and tell you there's no hope. There's always hope.
I had damage right at the eyeball where if that would have popped, I'd have been blind. So I met Dr. Ginsberg and he said, you don't have no problem, I can help you out. And that's what he did. I've been coming here for years, and at the time, no one would help me. You know, it's like going somewhere and no one wants to help, but he did. Dr. Ginsberg did.
If you wish further clarification about anything stated in this program, physicians at the More Eye Institute would be willing to answer your questions.